The Cook Medical BAKRI postpartum balloon tamponade system is part of the treatment of the severe postpartum hemorrhage because of atonic uterus. It is an important element in the management of the postpartum hemorrhage, and it is complement and not substitute of the uterotonic medical treatment of the uterine atony. The balloon is made of a catheter aimed to be inserted inside the uterine cavity and formed by two lights. The first one, signed by the blue arrow, it is the inflating system of the balloon that allows us to compress and stimulate the uterine contraction by a maximum volume of 500 milliliters. The second light, signed by the red arrow, it is designed to account the blood loss of the uterine cavity and to realize the real effectiveness of the system. The BAKRI tool is composed by silicone, so its use should be avoided in allergic patients to this material. On the other hand, it is latex-free, so it's permitted to be used in this case of allergies. Contraindications are uterine malformation, uterine rupture, placental retention, and endometrial infection. For the placement of the system, we should prepare the cage of the BAKRI balloon, Forester forceps, 500 mm saline solution, surgical pad, Foley urinary catheter, 2 urine collection bags, sterile gloves, and a surgical tray. In our hospital, we have organized a prepare kit with the uncountable material to open it in case of emergency and to take less time in the process. Inside the cage of the BAKRI system, we are going to find the next elements: the BAKRI balloon catheter and its two lights. The first one, the inflating channel, has a blue valve on its tip. The second one, that will be connected to a urine collector, it is the blood loss account system. The rapid installation components are the unidirectional triple valve with the red tip and the fluid system with the red ending tip, and the 50 milliliters filling syringe. The rapid installation system allows us a fast fulfilling of the BAKRI balloon without disconnection of the parts of the system, giving us the advantage of being faster during the procedure. The first step is to connect the urine collector bag to the exit blood account light of the BAKRI catheter. To start the assembly of the rapid installation system, we will connect the unidirectional triple valve, the fluid system with the red tip, and the blue valve of the BAKRI system following the mnemotechnic rule, red with red and keys straight line. At the free end of the triple key, we will connect the filling syringe, and with all the system placed, we connect it to the saline solution. See how the system allows the fast and progressive inflation of the balloon through the unidirectional valve with the syringe. Before starting the assembly of the balloon, make the 3-step checklist: 1 bladder catheterization, 2 placental integrity, and 3 non-uterine rupture. After the checklist, the first step is to connect the urine collector to the BAKRI balloon, so we could realize the amount of blood loss since the placement of the balloon and during its inflation. The second step is to assemble the rapid installation system following the rule red with red and keys straight line. Once everything is assembled, the gynecologist will place transvaginal, with the help of the Forster forceps or by hand, the BAKRI balloon inside the uterine cavity. After the placement, the assistant will start inflation of the balloon, and during the procedure, the gynecologist must keep with his hand the BAKRI inside the right intrauterine place. Remember to register the final saline volume used. We should finish placing a vaginal packing to ensure the correct position of the BAKRI balloon. After the cesarean section, the gynecologist places the balloon system through the hysterotomy incision. We should keep in mind that in the cesarean placement is the distal part of the balloon, the one that is passed in first place. In this case, we use the Forster forceps for helping us. Once the balloon is placed inside the uterine cavity and the distal part is passed transvaginal, the assistant should connect the urine collector back to realize the amount of blood loss, and then we connect the rapid installation components. Once everything is displaced, the assistant will proceed with the fulfilling of the BAKRI balloon, following the gynecologist's indications. Finally, we place a vaginal packing. If after the placement we have an unstable patient with apparently non-blood loss inside the bag, we should check if there's a clot obstruction of the light of the catheter connected to the blood account bag. To restore the permeability of the BAKRI balloon light, we use a syringe with saline solution to make a washing of the catheter light. After 12 to 24 hours of active action of the balloon, and once the patient is stabilized, we could make the extraction of the fluid of the balloon with the syringe, disconnecting the red key to the blue key. It is recommended to do this step inside the operation room, so if the bleeding restarts with the extraction, we could be faster applying surgical techniques for the atony management. The system without the rapid installation pack is placed with the same steps, but it doesn't have the unidirectional valve and the system, so it is more difficult to do a fast fulfilling of the balloon. When we want to fulfill the BAKRI balloon with the older technique, we connect directly the syringe full of saline solution to the blue key. After each 15 milliliters installations, we should close the blue key to avoid the loss of fluid pressure of the balloon inside the uterine cavity.